I like the topic, and I think it's pertinent. We're all talking about it. If we had more time, I would have loved to hear the all 40 something of us. I'd have loved to hear your expectations. What do you really want to get out of this? That's how I'd have loved to start. And if we can get that in the Zoom chat, it might help me just to guide this a bit. I won't be able to get to all of them because we don't have a lot of time. But I do want to speak to I want to know the people who I'm speaking with, and that's really important to me. And I think that's really important to advocacy as well. So Ronsi, if you can start with the presentation, we can kick that off. Okay. I have 20 minutes or a little less, I think. So I will keep my timer. I'm timely. I like to be on time, so I don't want to go over my time. So I'll keep a little timer for me. So I will stick to time. So, you know, for advocates, healthcare advocates, this time is both a blessing and a challenge. It's a challenge because the world is experiencing a pretty traumatic event. You know, we're all going through this very uncertain time with this viral infection that we don't know how it got here. I mean, we kind of know how it got here, but we don't, the impact it'll have on our lives is going to be, we're going to be talking about that impact for years to come. Not only do we have a health issue, we also have a health economic situation with the oil prices falling and, you know, lots of African countries not having enough domestic resources to fund services. And in Nigeria and in many other countries, we likely will have a security issue on our hands. So the world is going through this moment. The thing is that we're not going into this moment by ourselves. We're all in it together. We say at One that the global pandemic requires a global response. In a moment like this, there's so much we can do in the national front, but we really need to connect what we're doing nationally with what we're doing globally. And if I can get the next slide, Ronsi, you'll have to hit next a few times because the transitions on this slide are not great. So just hit next a few times so that all the words will pop out. Let's see, I think that is it. So what is health advocacy? You guys are health advocates, right? You already do this. It's just a training process to just do more of it. So I'm talking to the converted, as they say. Health advocacy is just a tool used to target the appropriate audience to ask for something: good health, better healthcare, more money for healthcare in our families, in our communities, in the world. I think it's important to note that health advocacy is not a thing advocacy is an active verb. It's not a verb, but it's an action word. It means you're doing something towards a goal. And in this moment of COVID-19, there's lots we can be doing towards the goal. The goal is to make sure countries, our communities come through this process without too much hardship. That's the goal. And that we set up our system so that we never come to a place where we're reacting again. Our systems are stronger when we pass through this COVID-19 moment. So how do we start health advocacy? We start with the advocate, right? You, all of you on this call, almost 50 of you. It starts with you, but it's not about you. And it doesn't end with you. I think that's important because sometimes I think as advocates, we kind of get consumed with ourselves, and you're just a vessel, you're the vehicle to advocate for a bigger community, for more people in your community. So just remember that you're doing it on behalf, you might benefit, which is good. When we advocate for Nigeria, we are beneficiaries of that. But it's not about Sarah, it's not about Ronsi, it's not about Ada, it's not about Samson. It's about a community out there. So with COVID-19, what have we been finding? First of all, some people don't think it's real. So as health advocates, we need to push out information about, this is not a government conspiracy. This is not they're trying to chop money. This is not any of that. It's a reality. We have a virus in our hands we're trying to contain. So first of all, pushing out that information that it's real. Second of all, I think the next pandemic that will hit the world is one of misinformation. that is already hitting us. It's a viral pandemic. It destroys. And what do we mean by misinformation? It's not just you know, putting together deliberately false information and pushing it out into the world. It's not just that, that's insidious and that's bad, but it's also you not verifying information and pushing it out. You know, all these forwards we're getting, I know you guys are getting the forwards. I'm getting the forwards too in droves. How are we checking those forwards? You know, the WHO website has Mythbusters where you can check if this information sounds right. NCDC website, there's the Twitter account actually is more accessible, but the website is there. There's the African CDC. There's actually an AU African CDC website where you can check what's happening. If you prefer social media, they have all those websites with social media handles on Twitter, on Instagram. So those are ways of verifying the information before you push it out. I know that our fingers get happy just to forward. We call it trigger happy. Don't get trigger happy. Sit with that information for a little bit. You guys are the gatekeepers of information for health because you are health advocacies. You're the gatekeepers to make sure that the information being pushed out, it's helpful, it does no harm. So misinformation is the pandemic we'll be dealing with. And as health advocates, it's very important that we pass on the right information, no matter how tempting it is just to forward something out of laziness or out of care, quite frankly, but it's wrong information. The second is you model good behavior. As health advocates, we should understand what the stakes are and we should be modeling this behavior. So whether it's hand washing, whether it's mask wearing, whether it's social distancing, or they say it's physical distancing because we want to be socially close, but physically distant. When I walk around Katampe, where I live, I see people selling food and they're sitting really close to each other. That's not physical distancing. So when we're gisting with our friends, when this lockdown is open, or if you're in another state, it's very important how to cough, all those things that we're passing on to people. We need to be the purveyors. We need to be able to showcase that information really well so that we're modeling good behavior. Can I get the next slide, please? So how do we advocate? You know, one, we are advocacy organization. That means that the image that comes to mind when I think of advocates are those people who will go to war on behalf of other people. They'll see something in the community that is not right and say, no, this, I'm not on my watch. And they open their big mouths and they start shouting about it. They use their resources and they start addressing it. Those are advocates. There's a specific goal that they have. So when we are, when we are advocating, we have 4 questions that we ask. First is, what do we want? What is our objective? What are we trying to do? You know, they say noise is different from a sound. You can be a noisemaker, just open your mouth and shouting and just doing all these things. A sound is a lot more targeted. So we're not interested in making noise. We're interested in making a sound. And what do we want that sound to achieve? So what do you want your advocacy to do? It has to be very clear, because the clearer that purpose is, the more you can get people together to rally around this thing that you want to do. Okay, so you've expressed and you've decided the one thing you want to do. The next question is, who's the decision maker? Who is the person with the power in their hands to make it happen? Or who is the person who you have to put the pressure to make it happen? The next thing is, what do we need to do to convince the decision maker that this thing is the right approach? Which means, obviously, you have to have some compelling facts, scenarios, figures, and the onus is on you. The burden is on you to showcase that this is important and it must be dealt with. Don't expect people, when you go to them, decision makers, that they'll agree with you and say, oh yeah, that's a great idea. Even though you know it's a great idea, they might not think it's a great idea. They might not even care about your idea. So now how do you convince them? That's the real work of advocacy. And then the next one is, how will you know if your strategy is working? How do you measure along the way? We have a framework here at One. We have the 5 Ps to policy change. So when we say, we call it 5 Ps and an M. So I'll give you an expo. One is policy. What is the data and facts around what policy, what advocacy, what objective we have for advocacy? We don't do anything without data. What are the numbers? What is the impact? Is this a big deal? Is this a small deal? We need to know rigorous facts about it. Your research is going to be very important. The second P we use is politics. Oftentimes with advocacy, with the kind of advocacy we do, policymakers are key to making that thing happen. So we look at, we don't care whether it's APC, PDP, SDP, CPC, it does not matter. Whoever is sitting in that place of power, we know is important to making this happen. The third one I'll say is public pressure, people. Coalition building is very important for advocacy. You know, one of the things I've learned is going it alone does not work. One-man brigade, your petrol will finish on the road, the journey to where you're going. But when you can carry people with you, that's where the power is. So for one, the public, carrying the public along is very important for us. And how do we carry the public along? Sometimes the public just doesn't care about this 1% CRF for health, for basic healthcare. They're just like, what is that? How does it affect my life? The onus is back on us to break that information down and tell them how it affects their lives. So public pressure is very important. Popular relevance is also very important, which is pop culture. The way we carry the public along, let Omotola say it, let Waje say it, let Burna Boy say it, let Idris Elba say it. All of a sudden people are like, oh, that's interesting. Who's the local person in your environment? Who needs to be saying it so that the public can hear? Is it MC Olumo? Is it Small Doctor? I don't know who those people are, but you need to, is it the imam? Is it the church leader? You need to figure out who people will listen to and have them come alongside you. The fourth is partnerships. I mentioned before, we don't go it alone. We go with other people. So that's going to be very important. Then the advocate, the person who we're trying to target, that decision, that policymaker, how do we leverage other markets? How do we leverage other communities? For us, as other countries, we want to do something in the G20. South Africa is the only country in the G20. How do we make sure South Africa is looped in and France is looped in and Germany is looped in? That's how we work. And how do we make sure that decision leads to impact? So for us, it's important to make sure that that policymaker, those policymakers are focus of our work, and then they lead us into how to make the decisions, how to make impact on this objective that we have. I recall there was a policymaker we're trying to reach, and we realized that his church, he's a government official, but his church is very important for him. So we thought it's important to get the head of the church to agree with what we're saying so that he can convince him. So sometimes there's a lot of triangulating to get to your destination. If I can get the next slide. So back onto how to advocate. So still on the process of how to advocate, just if you can click a few times, no, next slide, just click a few times, one more and one more. Excellent. So you as an advocate, you are by yourself in Ado-Ekiti, you are in Borno State, you are in, Gurara and Niger State. What are you going to do? First thing I will say is get some like-minded people around you. Advocacy thrives in partnerships. Advocacy thrives in coalition. In fact, if you can't convince other people to join your advocacy, there's a doubt as to what kind of advocate you are. So the first litmus test is, are you able to rally people around you to get this thing done? The next thing is, what are you doing in your personal capacity? Can you write, speak, share your thoughts, share your experience? Right now with COVID-19, we need eyes and ears everywhere. And the beauty of advocates, especially people like you, is that you are everywhere in Nigeria. I call you the eyes and ears of Nigeria. I can't know everything. I'm just here in Katampe. That's all I can tell you about right now. Everyone's locked down. But where are you? You're somewhere close. You can bring that information. Mohammed is from Niger State. Mohammed, you can bring that information right there. Kabir is in Zamfara. You can bring that information from Zamfara to the media. You can write and you can speak. Ronsi, can I get the previous slide? I'm still on the previous slide. We talked to some of our young advocates, and one of the young men, Isaac, is working with an organization called Slum Health Organization, I believe. And he has a website that has all the conversations around COVID. He has them translated into infographics in every single 60 languages, Arabic, French. I just have Hausa here. He has it in Akwa Ibom. He has it all over the place. This is one guy with his team doing something that is valuable. I'm going to take that website, I'm going to send it to the DG of NOA, because NOA is thirsty for information that conveys information to communities who don't really believe that COVID-19 is a real thing. They just think it's from Abuja or Lagos, and you know. So Isaac in his own little corner is thinking, this is how I can push the information out. Again, we're all stuck at home. I love Zoom, right? Zoom is telling us what is possible. Technology is telling us if the world shuts down, we have technology, so use it. And guess what? You guys are more technologically savvy than the older generation. So if there's anyone who's a master of technology, social media, it's the young people. So life has given us an advantage of how to use this thing. Get creative. People all over are getting creative about how to use technology. Let's not dull. Let's use this technology and rely on virtual gatherings to mobilize, to gather your people to talk about the things that matter. If you can get to the next slide. But who are you talking about? Who's your audience? Just keep clicking. One more. Excellent. This health information now is more critical than others. There's a proverb, there's a Igbo proverb that says, when the breeze blows. Can I get the previous slide, Ronsi?
Okay.
Thank you. It's the Igbo proverb says, when the breeze blows, the nyash of the chicken is exposed. So the breeze has blown, our healthcare nyash is exposed. Everyone's saying, yeah, we're really not ready for this thing. I mean, we always knew Nigeria had really bad statistics on name it. We have the worst, one of the worst statistics. We're not on the top of the line positively with health. Maternal mortality, infant mortality, HIV. I know we're growing in non-communicable diseases as well. And I'm sure Ronsi can tell me a lot about the cancer world and what's happening there. And it's probably not positive. So now here we are, we have a conversation with ourselves. Things are not going well with our healthcare system. How do we advocate for that? How do we make sure we get out of COVID-19 stronger with our healthcare system than we entered? It depends on who you're talking to. I don't know where you are. I don't know what's happening in Zamfara State. I don't know what's happening in Niger State. I don't know what's happening in Akwa Ibom. Who do you need to speak to? Who is the audience? You need to define that. You need to figure out what you want to do and define who you need to speak to. Don't ignore, don't go to, everyone's run to federal government. Oh, government needs to do this. Where is the state government? Nigeria is like 36 countries. Every state is like a country. State governors is now we should put their feet under fire. They need to be doing the best. And if they're not doing, we need to address it. Local government chairmen now have a budget, guys. They have a budget. So what are they doing? We don't have to go far. Local government, your community imam, your community organizing group, maybe that's your target. So you need to define your target and don't ignore what's close to you. Citizens, advocacy game is changed now. We're now doing a lot of online. We have everyone's looking for information. WhatsApp is reaching further and further in. How are we using that to advocate to citizens? And because the wind has blown, everyone's ears looking for, oh, how do we improve the healthcare? This is the best time as health advocates for us to rush towards this and make sure that we are doing the best we can to push the word out on healthcare in Nigeria. So what happens after COVID, right? What's the world going to look like after COVID? If we can get the next slide. At the end of the day, you know, when we were advocating for 1%, and I'll go to that a little bit. I know that I'm running to about a minute left. We're advocating for 1%. One of the things that we heard is like, Nigeria's in a recession, we don't have money. So we need to do infrastructure, we need to do jobs, da, 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 da. Agreed, but health, if we don't have a healthy population, what do we have? Who is all the infrastructure and jobs for if we don't have a healthy population? So health truly is wealth. So you guys as health advocates have an upper hand. And as young people, you literally are controlling what happens because you are more exposed as far as social media, as far as technology, and the future is ours. You know, Nigeria has 75% of our population under 35. That means young people under 35 are supposed to be running things. Like we are going to be we're going to bear every single impact of all the things happening. Can we get the next slide, please? And we can skip that slide because I'm done with it to the next one. So what one did is we, the Make Nigeria Strong, exactly. We are right now advocating for Basic Healthcare Provision Fund. Hui must work. Hui is a basic product that the federal government has released that has some free services, and I've listed those free services there. Primary healthcare is the foundation of every single healthcare system everywhere in the world. Yes, we have a pandemic, but we can never forget that if we don't build our primary healthcare system, we don't have anything. So right now we're using technology. We have a bot, AI bot, where you can go ask questions about primary healthcare. You can go ask questions about COVID. If you go on Facebook and the link is there, you can go chat with this bot. We're trying to get smart with technology and use advanced technology to do things. And please give us feedback on how that's working for you. If you can get the next slide. One of the things one of the quotes I love is the one by JF Kennedy. I wish he was Nigerian so I can claim him as mine, but he's not, he's American. He said, ask not what your country can do for you, ask what you can do for your country. It's always been my own personal rallying cry. I know oftentimes we want to say, what is Nigeria doing for us? And the answer might not be satisfactory to your soul when you answer that question. But you know, the real question is, who built other countries? It's their citizens. Who built Italy? Who built America? It's the citizens. So if we want the Nigeria that we have always dreamt about, we have to build it. And yes, it is frustrating. Yes, it's challenging, but yes, it is doable. And with health advocates like you who are committed to a cause, nothing is impossible for us in this nation. And I do think that we will, in my lifetime, I'll see a new Nigeria. But I need all of you to keep doing your part in the corner that you are and do with others. So that's it from me. I'm sorry I was 1 minute over. I will allow now for questions. Over to you, Ronsi.
Thank you so much, Ma. That's really very inspiring. And I really love the presentation because you also try to give us an example, especially with what you're doing with the Federal Ministry of Health about primary healthcare. That's really, really good because so many people don't even understand the benefit of getting primary healthcare to work. Because without it, we're just, we have nothing to really fall back to.
That's correct.
Yeah. And one campaign is doing a phenomenal work, honestly, doing an amazing work. Yeah.
Thank you.
Thanks for having time to come with us, please. Really appreciate it.
No, it's my pleasure.
Yeah. Chinonso, have you got some questions? I have a question here that I want to ask. So Chinonso, maybe you can start preparing your question. We've got some questions from email. We've also got some questions from WhatsApp. So just to also provide a few more information, some people joined us who are not like part of Project Pink Blue. Mm-hmm. We have 172 people who registered for this meeting. Mm-hmm. Unfortunately, we can only take 100. Yeah. We have people from South Korea, we have people from the US, we have people from the UK, we have from almost we have about close to 19 states across Nigeria. Wow. People who are joining us. And so some of them have sent their questions. So some questions that are alike, we'll just have to merge them into one. Chinonso will deal with that. But let me ask this very important question. I don't know if it's important, but I think, yeah. Ma, please, there is always this thing that comes up, especially for young leaders, when we have meetings about advocacy, getting our leaders to help us to understand the need to do something. Sometimes people will tell you that you are lobbying. Mm. What is the difference between lobbying and advocacy?
Honestly, very little. I think it's a choice of word. So lobbying is like advocacy. Lobbying, unfortunately, has gotten a very bad rap. It's gotten a very bad reputation out in the streets. They think a lobbyist is a person that goes to government for their own desire. So if I want to import tiles, I will go to government and say, you need a tile policy so that I can import my own tiles. It's something that benefits you. Advocacy is like lobbying. The difference, to clean up the name lobbying by using advocacy, the difference is you're not lobbying or you're not advocating for yourself. You're advocating on behalf of others. Now, what makes a legitimate advocate is the person and the people who advocate with nothing personal to gain. The minute your advocacy becomes seen as, if I do this, it's going to economically benefit this one person's pocket or this group of people's pocket, you become a dodgy advocate. The people say, hey, you see, they've come again. It's just for their own selfish things. So the more authentic an advocate really doesn't do it for themselves. Not to say you won't benefit as a larger part of your community, but it's not really about you. You've seen a need within the community, and it also gives you the power and the audacity almost to ask for things, because it's not like it's entering my pocket. It's for these 100 people, these 1,000 people, these 5 million people in this community. So I don't believe advocacy and lobbying are very different, but lobbying just has a negative connotation because it connotes selfish gain. And for me, advocacy is a more neutral term that connotes community gain.
Thank you very much. Chinonso, are you ready?
Yes, I am. Of course, I am. Okay. Thank you so much, Ms. Sarah, for such very informative presentation. I have a couple of questions here.
Sure.
And the first one is, what does the future hold for health advocacy?
That's a good question. So what does the future hold for health advocacy? Honestly, I think health advocates need to be louder, need to be more knowledgeable, because it almost feels like the earth and the universe has conspired to ensure that health is on the top of the agenda for the entire world. We've got 7.4 billion people in this world who are thinking health. It's either affecting them directly or indirectly. Now, captivating people's audience is the hardest thing to do in advocacy. How do you capture
Hello, Ms. Sarah, are you there?
I think we lost her at some point, yeah.
Oh.
Yeah, but she's online, so she will come back soon.
Okay. You guys could keep dropping your questions in the chat box. I'll take them soon as she returns.
So how many more questions do you have, Chinonso?
I have about 4 to 5 questions.
Okay. I also, some people send me
okay.
Some people send me as well, so I also have I think 2 more here.
Okay. All right, fantastic. It was a very, very interesting presentation. Yeah.
I'm sorry, I got kicked off from Zoom.
Oh, so sorry.
No, that's okay. This is our reality with technology. So I think I answered the question on what the future holds for health advocates. Let's make sure we use this time wisely.
Okay. All right, great. Thank you so much. I have another question here. As a health advocate in a location where people hardly believe COVID-19 exists, how do you deal with the frustration of getting mute when you speak out about its development?
Yeah, no, this is one of the realities of today, isn't it? I don't have all the answers, but I have a few things that I'd like you to think about. Who else in your community understands the reality that COVID is real? Who else around you? get them together, brainstorm. Every community is different and it has different peculiarities. What is peculiar about that community? So what is the best way to get them? You know, there are people who we call cultural gatekeepers. When a cultural gatekeeper says something, everyone pays attention. For us, sometimes it's pop culture. That's why we use pop cultures, because they're cultural gatekeepers. If you live in another part of Nigeria, it might be the chief. And can we get him or her, I guess it's a him, usually in Nigeria, to understand about COVID-19? If he is the purveyor of false information, who else? Who is the waziri that he listens to? You have to get really creative. And advocacy is not a intellectually lazy sport. It's like intellectual, mental sports. So get people around you, think through your community, find ways. How do you plant this information in places that people trust, with people that people trust, and have them be the ones that talk about it? But the first step, port of call for that kind of community is, how do I get you to believe this thing is real? And that will depend on the community, but don't do it alone.
Chinonso, next question.
Yeah. Okay. All right. That's fantastic. Okay, I have another question. Yeah. Yes. As an advocate, you may have the mindset and conviction that health issues should be addressed, but he or she doesn't have the resources to go about it, especially reaching out to policymakers. What should he or she do?
So if I understand the question correctly, it's you have an objective, you don't have resources, and you want to reach policymakers. Is that correct?
Hello?
Yes, I think that's correct.
Yes. Okay. I think there's a delay on your call, on your line.
Yeah.
You know,
Exactly. Yes,
yeah.
that's it.
Policymakers are,
Yes.
we're lucky in this era. Policymakers are more accessible through social media. There's a lot of noise in social media. So if your handle can be the one that provides guidance and provides a reasonable conversation, that's one plus. Because policymakers are a lot more accessible on social media is going to be a place that you go to reach them. And it's free, right? Creating the messaging is something you can do, and you can leverage what other people are doing. That's free. Getting your friends and colleagues and, you know, friend of a friend to get other people to care about this issue so they can also amplify the message is also important. It's free. So we need to get creative. There'll be a time that you don't have free anymore, but and you need resources. But what can you do with the limited resources you have or the free opportunities you have? There's strength in numbers. Even when something wants to trend, there's a algorithm for trending. So many people need to be talking about the same thing and it trends. So many people need to be doing the same thing and people take notice. How can you get so many people to do the same thing? You might be in a village somewhere and you're the only one with Twitter, but you know people who live in the urban areas who you can say, hey, you know, tomorrow's my birthday. It's not true. Saturday was my birthday. You can say, for my birthday, I want everyone to talk about this one thing. That's my present. I don't want a present. You can't come chop in my house anyway because we're on lockdown. So why don't we all talk about this? Look for creative ways of getting people. And the beauty that I found is that money looks for value. So at first you can be starting and you don't have resources. If you're doing something well, funds will find you. People will take notice and say, there's someone somewhere doing something. And you started small. I love the story of Connected Development, how they started. Because they started small and they said, we're going to a community, we're reporting things out. They use their resources. Now, people look for them to give them grants. Yes, we can't all be a Connected Development, but the principle is still the same. Do what you can with what you have. Make sure it's valuable, make sure it's good. And the world will take notice, even if it's not the largest 7.4 billion world, but people will take notice and support you to do that. And there are other things we can do. A friend of mine wanted to feed people in Jos. She started a GoFundMe. She raised $5,000 to feed people in Jos. She doesn't have any money, but she said, hey, I need money to do this. And people trusted her. You know, Nigeria, sometimes people don't trust people. People trusted her and gave her funds. So there are creative ways of crowdsourcing, creative ways of doing free things that we must tap into.
Wow. Maybe I can jump in now and ask a question that I got from my own end.
Sure.
So just in case if you want to follow Miss Sarah, just check out her Twitter handle is at SZ Maka. Maka that's SZMAKKA. So you can follow her on Twitter and get to know about
please. Yes, please.
Okay. So let
Great.
me quickly just throw out. I got a question here. The question says, politicians see advocates as enemies. How can we young advocates who do not have enough money and haven't been able to build a family, and we are afraid of being shut down or being arrested, how can we address this perception of enmity?
Yeah, no, it's a fantastic question, and it's part of our reality. So your question is layered because there are two things. One is how advocates are viewed by the political class, and I can address that. The second question, though, is that what I got from there is when you are up and coming, when you can't afford to lose everything for a cause because you have family members that depend on you, and you know you're not ready to be a martyr for this thing. How do you advocate but still keeping your security? So I'll answer the first question. The first question, I think that perception is changing. Maybe not widespread, but because we engage with policymakers a lot. Not all of them see advocates as enemies. Some do, truthfully. One of the things we don't like combative advocacy at one. We want value-driven advocacy. We go to a politician and say, hey, we're going to send you a report we did on this issue. You're the House Committee chair on basic healthcare. Let us help you by sending you value. This is the state of basic healthcare in Nigeria. This will help you as a House Committee member or chairman of the House Committee member. So value and advocacy are one-on-one. You don't just meet people and then just start saying, you're rubbish, what you're doing is horrible. Nobody wants to hear that. So how are you adding value to the work that they're doing? Oftentimes we'll tell the politician, this is your last term. You're thinking about legacy. You're thinking about how to make a difference. We can help you. If you address this issue, you can start creating a legacy. We're not telling you we're doing anything for you. We're just saying, if you join hands with this issue, you push your agenda, you push our agenda, you create a legacy. And we can tell them also, we want you to be a spokesperson for this day. We want you to write an article for us. We want your mouth to be, we will be in the background, you can shine, or policymaker, but just shine on this issue. So that kind of value, collaborative advocacy is important. We're also very clear. If you do things right, we will go on top of the mountain to say this person did it right. In the same token, if you don't do it right, we will also go on top of the mountain to say this person did not do it right. So we're trying to build a relationship with advocates so they know my objective is not to make you look bad. That's never my objective. My objective is the advocacy objective that I have that is in front of me. That's my objective. Once they know that your objective truly is good and they can be a partner to your objective or they can be foe to your objective, but you're here to add value to them, I think that's better received. And honestly, not every policymaker cares about the objective. Some of them are just like, I really don't care. So it's important for you to suss out this policymaker. They might not, going the sort of value way is not the best part. We need to add pressure through their spouse. Maybe their wife is more excited about this thing. Let's go to her and she can put pressure on her husband. Or maybe the imam gets it and he can put pressure on this person. So I think that advocates are not always foe. So, I mean, policymakers are not always our foe. They're sometimes our ally. And quite frankly, we're found in one that sometimes the policymakers that invite us, they say, we want to do this thing, but if we do it, Nigerians will say we padded the budget. This happened to 1%. So if you as CSOs don't shout that you need this thing, our hands are tied. Oftentimes in government, their hands are tied, especially when they want to do well. And our voices add the compulsion to make sure that they get the thing that they want to get done. The second question is young people up and coming. It's hard, right? I mean, I'm privileged because I'm paid to do this. It's hard. I think coalitions is the answer. Coalitions provide security. Coalitions provide a bit of protection. There's power, there's protection in all of us are going. Last, if 100 of us go, would they jail all 100 of us? It would be very hard to put all of us in one cell. So coalitions become a beautiful way of doing what you want, you believe you should do, but you're not quite sure you want to stake it all. And slowly by slowly, as the environment opens up, you can do more bold things. But don't forget coalition. Don't do it alone. Go with other people. Don't be a lone star. Don't be, one-man show. One-man show, one-woman show. I don't believe in it. I think that doing it with other people, there's a lot of strength in that. So that's my response to you on that.
Wow, thank you very much, ma'am.
I'm enjoying this, honestly.
I'm glad.
Okay, Chinonso, do you have additional questions?
I have a question. I have a question.
We have to finish this session at exactly 5. So Chinonso,
No, I don't have any other question from my end, Mr. Onsi.
okay.
I have a question, Ronse.
Okay, yeah, sure.
Okay, what can we do to volunteer for this COVID-19 that is happening right now? I just left Kano for Abuja about 1 week ago. And right now, I actually think there is a way I can go ahead to join the fight against COVID-19 that is happening in the world today. So what do you think we can do to volunteer our own side to the society?
It's a great question, Sunday, and I'm glad you're asking that question. This is a question I get a lot, and there are 2 responses. One, there are many things that exist around Nigeria. A friend of mine sent me something called givefood.ng. They're trying to provide 1 million meals a week to people who need it the most. I trust this person, so I trust the platform. My only challenge is it going to reach rural areas? Someone else had beating corona.ng that correlates all the things that are happening in Nigeria on donors, who's giving what. There are other things popping up everywhere. When you go on social media, you see people starting things. You can join one of those things. The second thing is you can start something, because you know Kano better than I know Kano. What's happening in Kano, you can get on the phone and start collecting information, have a website, even if it's a simple website that says, if you live in Kano, these are all the initiatives that are happening in Kano. These are the ones I vetted. This is the one-stop shop, and you'll be pushing out that website so that when people like you, Sunday, are looking for, how do I help? They can plug into organizations that are doing something, whether the organization is information, pushing out information, or the organization is feeding people, or the organization is pushing information to policymakers to say, no, this is not okay, what's happening. People can plug in, but we don't have enough structures. Nigeria, information is like gold, and people like to hoard it. If we can find people who break information and make it more democratized so that everyone can have it, you're actually adding value. You're actually saying, I can bring something to the table. And what I'm bringing to the table is, in Zamfara State, this is what's happening. In Kano State, this is what's happening. A friend of mine called me from the US and said, I really want to help. I said, this is what's happening. You can plug into this. What she had was, she didn't have money, but she had people on the ground. There was a website that had collecting information. So the people on the ground feed information to the website in Jos to say, this is what's happening in Jos. You can plug into existing things. You can give yourself, you can create yourself, but there's a lot of room right now for people to do something.
Okay, wow, thank you very much, man. I have a question from Rofiat. Rofiat is in the UK, and she said, knowing the impact of food and behavioral change in health, how can this be achieved with advocacy as well in Nigeria?
Yeah, so food and behavioral change in health. The good news is that there already exist things that are happening. So there's a whole lifestyle, medical doctors who say, Hospitals need to teach you how to live healthy lifestyle, not treat the sick. And a lot of our hospitals are treating the sick. There's a whole movement of people who say our local foods have in it the nutrients and the spread that can help our bodies be healthier. So there are things that you can start. The CS Sun works on nutrition. There are coalition of nutrition organizations that you can look into. Beatrice, I believe, heads that. What already exists? There are agricultural organizations that fortify millet with vitamin A, iodine with salt, so we can get those trace minerals we need. There are voices that exist. The question is, do you know those voices, and is there a one-stop shop for where to find those voices? Again, here's a value you could add, which is you're looking for this information. You can start collecting it and if the others like you out there, then you can point them to this website that says, hey, this is the link to the organization that does this. This is what I'm personally doing. Because so much is coming at us so quickly. People who can develop the structures to help funnel our attention to the right sources are very valuable. That is value adding. So if from the UK you can do that, that would be great. If you can do it for Nigeria, that would be great. But already that exists. So it's finding how to plug into existing structure or help amplify those existing structures.
Okay. Now we also have a question from Kabiru Garba Gusso from Zamfara. Actually, I was born in Talata Mafara, so Zamfara is always very interesting for me.
Home away from home.
Yeah, exactly. So Kabir is asking, Ma, please, do you have some tools on advocacy, especially on health advocacy, that you'd be willing to share with us?
Yes, I do. And actually, I'll make a distinction. Kabir, health advocacy and other advocacy is kind of the same thing. It's just that for us, our target is health. But you can apply this to nutrition advocacy, you can apply it to education advocacy. It's a framework for how to advocate. So we have young champions, one champions, there are 50 of them every single year. We train them and we induct them into how to be advocates for their communities. What I'll try and do is I'll try and get some of those materials. We usually have it in person. This year, we're trying to have it online because COVID-19, we can't meet. And one of my exciting points of that is that we want that information to be shared with everybody and anybody. We don't want to hoard good information. So that is coming up, towards the middle of the year. But for right now, I can share some advocacy frameworks we have. I'll share them with Ronci and he can share with all of you that have attended. Just pick what is useful to you and, use that and continue to remain in conversation with us so that we can see how we can support you. You're in Zamfara State, we should have some champions in Zamfara State, we can connect you. The other thing is connecting people who are like-minded. I don't know if I've said this enough, but don't do it alone. Connect with other people because that's where the secret of the power is.
Okay. I think we still have a question here, and I guess this should be our last question because we're already like 4:59 now. This question says, what do we do when 90% of citizens still singing, blaming the government? Because I have experienced this in Zone 5 Abuja. That's from Hannatu Pamela Ishaya.
Yeah, Hannatu, I struggle with this, finger pointing to government, and government should give us everything. And, we run a risk in Nigeria to look to the government for everything. But I also know that our context, Nigeria, it almost builds it so that you look to the government for everything. So some of us just have to break out of that. There's a place for personal responsibility, but that's also limited. There's so much you can do, and you need to start, and there's some things the government must do. So it depends on the issue that we're talking about, but I like to point people to personal responsibility. Yes, we can point hands at the government when they're not doing our part, but have we finished doing our part? Is there something we can do? Government can't do everything. And the reality is that oil prices are negative. It was negative $3. It cost us about like $12 or so dollars or $15 to even pump oil from the ground. So when it's like $30, we make that markup. When it's negative $3, we're now looking for people to, in fact, we're paying, if you want to buy oil, we are paying you to buy oil. because 90% of our country's revenue comes from oil. What does that mean? When it's time for FAC allocation, when we draw down our reserves, there'll be zero, as in governors will come and they'll be like, government can't do anything because we've relied on oil so much, and oil will go up and down now. We're in trouble. Soon we'll go to a place where it's like, remove government from the equation. No, we need to start leading government. We need to start doing things that can support our neighbors, our community. We can't look to government for everything. I pray the day doesn't come that we have zero in our accounts. And, you know, as they say, inshallah, we'll make it through. But in the event that that comes, what is our responsibility? What are we doing to ensure that 60% of the food does not rot in the farms? It's not a government thing. I mean, government can incentivize, but the things we can also do. How do we ensure we distribute food to those who have it and those who need it? Let's Give Food.ng is doing just that, taking food from grocery stores, passing it to people who are hungry. There are some things that we can do. Let's do those and let's focus on those. And then we can adequately blame government at that point to say, you have not fulfilled your end of the bargain, but here we have some solutions for you. Let's bring solutions to the government. It's hard work, and we're here having a conversation and it seems like the words are coming out of my mouth, but it's hard work. It takes persistence. You'll be discouraged a lot of times. With advocacy, there's a lot of discouragement, but if only the persistent win, only the pragmatic win. If you don't get 100% of what you're looking for, you got 50%. Let's take that. Let's build on that. Let's keep going. Keep pushing. We have to keep pushing with advocacy.
Yeah. Wow. Thank you so much, Ma. I mean, I've really learned a lot myself too, and I'm sure I've been seeing lots of messages. People were all thanking you for, you know, this very insightful information. And it's always good when you like bring speakers, don't just bring speakers who just come quote from literatures, but from experience, sharing from the work they do. You know, that's really like, I mean, something you really said that really caught me is the combating advocacy, you know, switching to value advocacy. That's really, really important, you know, getting them to be in the front while you're behind. Yeah, thank you so much. We all at Project Blue greatly, greatly appreciate this moment. Immediately COVID-19 started, what we did was to shut down the office instantly and ask everyone to work from home. In fact, we started working from home before the government declared they stay at home, and quickly we pushed all our operations online. And next thing we did was to assure all our staff that you're not going to lose your job. Your salary is guaranteed to the end of this, because that's really scary for everyone. And people were really scared, like, you know, this is a non-profit, this is not government, and, you know, we don't know what's going to happen. And the board provided that assurance to everyone just to ensure that people don't also come out from COVID with lots of psychological issues, you know. Yeah, and then at Project Pink Blue, we have over 1,000 volunteers. And we're really grateful because Project Pink Blue is a very small organization. You can't believe we're just about 7 of us. But, you know, but when people see our World Cancer Day having
small but mighty.
Yeah, you know, there was a time when we won the World Cancer Day award in Malaysia. Somebody asked me, how many staff have you guys got? I checked your website, I just saw like 7 people. And I said to the person, yeah, we actually have over 1,000 volunteers. And sometimes when we have our volunteer meeting in Millennium Park, sometimes we have over 50 people, 70 people. And then we just say to ourselves, only us can actually have a walk. Yeah, that's so right. Yeah, these are all amazing people from, they all live in different parts of the world. AB used to be with us in Abuja, but now she's in South Korea. We've supported all of them. So many of them have been supported us from where they are in Finland, in the UK, US, and all the rest. So really, really appreciate you. As you may be aware, Project Pink Blue started as an NYSC CDS project in 2013, and just more like the poor, helping the poor at that moment, helping breast cancer patients. But right now we've all moved, you know, helping so many other young people, helping women and helping our community. So we really, really appreciate you. On behalf of the board, I want to also thank you so much. I don't know if we still have Madam Khadijat on board.
I don't think so. She's having network issues. So she's on.
So Ma, thank you very, very much. We greatly, greatly, greatly appreciate the work that you do. We thank you for making our time to really join us. We will switch. Ma, do you want to respond to anything before?
No, I just want to say thank you guys. Thank you for this time. In Nigeria, we are very generous people, but I find that the art of volunteerism is, especially formal volunteerism, people will volunteer and expect something in return. So to see true volunteers who are here to serve really inspires me. It inspires faith in Nigeria. So thank you guys for the work that you do. Thank you for how you started, Ronsi. Thank you for having me. We're all in this together. So let's just keep rubbing minds together.
Good. Thank you. And then if you check the chat box, you can check the One Campaign website. You can check their website, find out a lot of their work. I know that One Campaign has what they call the One Champion. And you can apply to become a champion. Maybe
that's correct. Well, we just finished the application process. So we're reviewing applications right now, but next year, maybe.
Fantastic. And I have a number of friends who actually were choosing for the One Champion. And some of them have been doing a number of work. I don't know how you've been supporting them, but I think it's really amazing.
Great, great. Thank you, guys. Can I sign off now, Ronsi?
Yes, Ma, you can sign off. So
excellent.
Thank you so much, ma'am.
Bye, everyone.
Bye. Good. So thank you all so much. I will have to stop the recording right now, and then we can switch to our volunteer meeting quickly for the next 30 minutes.